Welcome to this next session. Lovely to have you all here. I'm Jenny Hall, and my role is to chair this meeting. And I'm just going to, at the beginning, to introduce to you Kathy Whyte, who's going to be doing the first half of this seminar. She originally trained as a nurse and a midwife and has a master's in nutritional medicine. Kathy has a keen interest in preventative health, how parental lifestyle and behavioural choices influence maternal health, fetal development, birth outcomes, and a child's risk of developing health issues, such as asthma, allergies, obesity, and chronic disease later in life. With 70% of all illness being non-communicable, lifestyle related, the best opportunity we must reduce the risk of these health issues is before, during, and following pregnancy. Kathy is determined to increase awareness of the importance of early life health, developing healthy lives with health professionals and budding parents. Kathy's business, Nurture Mum, offers expert-led, evidence-based advice and support within the workplace, pharmacy, and on social media platforms. And it's nurturemum.ie is the website. And I'm just going to pass over.
Everybody. And I am delighted to be part of this event. For the next couple of minutes, I'm just going to talk you through the role of the midwife in developing healthy lives. Sorry, David, it's just not sharing the slides. Hello, David? So there we had Professor David Barker. I've really had a long interest and fascination with his work. The Hertfordshire study was sort of fascinating. They were birth records that had been maintained by an incredible midwife many, many years ago. David Barker took it upon himself to go and find these birth records and understand what they were saying. And he came to the conclusion, quite fascinating, that babies who were born less than 5 pounds versus those who were born greater than 10 pounds had a double risk of developing cardiovascular disease later in life. So it was through my studying of nutrition that I really became involved and fascinated by his work. He then went on to look at birth records in Holland and found that at the Second World War, birth records again revealed that mums who had very limited access to nutrition during 6 months period of time had an increased risk, their babies had an increased risk of heart disease and becoming overweight and diabetes later in life. So with my fascination with the late David Barker's work, I emailed him from Dublin one rainy afternoon to Southampton and asked him if I could come and meet him, because I felt so much of his work wasn't in the public arena, in the public health space. To my astonishment, he asked me to his house for lunch. This is a number of years ago. I gladly accepted the offer, and we had an amazing lunch, an opportunity to talk and sort of share our sort of fascination with this whole space in terms of the early origins of health, and that preconception and pregnancy and those early life days are the greatest opportunity we have to influence health of mum and baby from the very beginning. Sadly, David Barker died suddenly just a couple of months after I met him. So I guess a lot of my work and just trying to influence health of mum and baby is in his footsteps, really. And by sheer coincidence, I realized later that we actually shared the same birthday, and we both actually, he studied medicine in Guy's, and that's where I did my nursing. Next slide, please. Paul, can you please share the next slide? Paul? Okay, so increasingly, the whole sort of concept of how the 9 months shape our lives is becoming more mainstream, which is fantastic. But I think we have a long way to go. Certainly during my midwifery training, this didn't really come onto my landscape. As I said, it's only since I have studied nutrition that it really sort of became more aware of it. And just an interesting thought, and I guess we don't often stop to think about it, is that when you are pregnant, you are actually pregnant also with your grandchildren. So the eggs that are formed during pregnancy will be the eggs that go on to develop and form the next generation. So this whole thing of exercise, healthy diet, etc., is an intergenerational thing. And sometimes it just can go on in terms of poor health. So there's a big onus on us to try and challenge this and to sort of address it when it becomes an intergenerational issue. So 91%, this is the percentage of people throughout the world, and specifically in Ireland, that will die from a non-communicable disease. Again, we're talking cardiovascular disease, diabetes, etc. So lifestyle disorders. And we know that so many of these are preventable. And again, back to the early origins of health. So pregnancy is one of the greatest opportunities we have to influence and prevent these disorders. If we look at the global burden of disease across men and women, we know that in women, raised blood pressure, raised body mass index, and fasting glucose are the greatest contributors to the burden of disease in women. And for men, it's smoking, increased blood pressure, and really interesting low birth weight and gestation. So we know that this is important for men and women, but particularly men seem to be more exposed. So men who are born with low birth weight and short gestation seem to have an increased risk of non-communicable disease later in life. So if we're to take a moment to step into sort of the zone of the womb, it's a really interesting space. And a lot of the time we don't sort of put our sort of mind and focus in terms of that growing baby and fetus. So we know that that baby, the growing baby there, can read a lot of what's going on in the external environment by the nutrients, etc., that they're actually receiving. They're hugely, hugely intelligent and adaptive. And we know that the fetus has what we call a thrifty gene. So if they know that they're in an impoverished situation where they've minimal access to nutrition, they actually prioritize development of the brain and the heart as means of survival over other organs. So we know, for example, that this can impact the development of the kidneys, which can in turn translate into an increased risk of hypertension later in life. We also know, for example, that in the last month of pregnancy, in a healthy pregnancy, there's 2 liters of amniotic fluid, and that baby drinks 1 liter of this every day. And that's when their whole taste exposure and taste preference actually starts to begin. Many years ago, the French did a carrot juice study, and they gave mums in their last trimester a lot of carrot juice, and they didn't give other mums. And when it came to weaning, the babies who had been exposed to that carrot juice adapted much quickly to eating carrot, measured by facial grimaces. It took a little period of adjustment for those that hadn't been exposed. So really, really interesting in terms of this fetal environment and fetal nutrition. And I think more and more we need to put more focus on it in terms of what we can do to sort of really enhance and promote healthy development of that baby beyond just measurements of scans, etc. So as a midwife, in terms of messaging around developing healthy lives, I suppose there's some key pillars and anchors here. So pregnancy planning is vital. Obviously, as a midwife, most of the people that you're seeing are already pregnant, but you've got that opportunity inter-pregnancy. So pregnancy planning is really, really important. And for dads too, for so long, the sort of preconception health space has been dominated and focused on maternal health, but more and more we're realizing the importance of dad's health too in that preconception. So we know that smoking has always been a contributory factor in terms of influencing potentially the health of the growing baby. But now there's more and more research around dads and their weight preconception, and that's a possible influencer of the child's weight. We also know that it's a really important time for tobacco, smoking, and alcohol review. healthy eating and supplementation and physical activity, but just being a healthy weight. If there's one message, it's for people to aim to be a healthy weight before pregnancy. We know we have a 1 in 2 opportunity to do this with 1 in 2 pregnancies planned. Nutrition and supplementation, really, really important. In terms of supplementation, I'm talking folic acid, vitamin D, and there probably is some reason or requirement for mums who are vegan, vegetarian, etc., who do not eat fish, to take some fish oils. And the growing space, and a really, really interesting space, is the whole space of gut health and how that is. We know that it influences about 70 to 80% of our immune system. And again, the messaging around that, even though I know your clinic time, etc., can be pressurized, is to really try and swap the food groups from sort of that beige food to brown food. You know, the more colorful food we eat, the better it is. In terms of lifestyle, physical activity and stress management, really, really important. I think for a long time we've underestimated stress and pregnancy, but we do know that it's crucial. Sadly, back in 9/11, that awful incident many years ago, we know that on that day, the number of premature births that happened in response to that event was huge. So, I mean, that's an extreme example of stress. But on the other side, we know there's some very interesting data coming out of Irish hospitals, and I think globally also, in terms of this COVID period of time. And we know that some of the hospitals in Ireland, the first one over in Limerick, reported a 74% decrease in early delivery. Fundamental here really is breastfeeding, and to start that conversation really early in terms of how mums are thinking of feeding. It's not all about breastfeeding. Breastfeeding isn't for every mum, but where there's an opportunity that we steer and people can actually prepare and to start to think of their breastfeeding journey very early on. So the message here is thinking for 2, not eating for 2. And indeed, the demands on extra calories, there's only a demand for about 200 extra calories in the last trimester. So that equates to maybe 2 pieces of wholemeal bread and a banana, but that's all the extra requirements for a healthy pregnancy, which is not huge, but and we just need to sort of get that message out. And the more we exercise in combined with healthy eating, the better it is. And again, back to fetal health, we know that for moms, the more they exercise, the more it promotes a variance in the fetal heart rate that is part of their whole heart journey, heart health journey. So just on a practical note, I know as a former midwife some years ago, public health may seem remote from day-to-day concerns of a busy maternity hospital. And midwives have a really important, if not essential, public health role. And acknowledging the importance of effective public health strategies should be central to midwifery practice. So these are sort of the pillars of it, but I would love to see it becoming more mainstream in terms of midwives being upskilled more and more in terms of nutrition and making that sort of short messaging, whether that's 30 seconds or 1 minute, meaningful in terms of maternal and child health. And just as I close out, it was a sort of COVID project that I developed, but it was a Mum and Baby Health series that I ran last summer. And I got 10 experts who kindly came on board over 10 sessions. So we had a pharmacist, obstetrician, dietitian, physiotherapist, all aspects of mum and baby health before, during, and following pregnancy. It was a hugely successful event in terms of the numbers who registered, etc. And we got some really lovely coverage in the papers, some really interesting interviews with journalists. So their point on, they said they don't get to cover this a lot in terms of the early origins of health and disease. And a lot of the time it's about the journey through pregnancy to labor. And of course, that's really, really important. But there's a big appetite for more and more of this out there. Indeed, we got a double-page spread on one of the papers. So it's definitely an opportunity, and people want to hear more of this, how they can build healthy babies and developing healthy lives. So just as my final remark, midwifery is what women want and what the world needs. So I just love this comment. and this quote. So thank you again for the opportunity to speak here. And I look forward to perhaps meeting you all again in the future. And if you have any questions, we'll be delighted to take them. And you also find me on nurturemom.ie. Thank you very much.
Thank you so much, Kathy. And you were dead on time. we've still got 5 minutes at least, if not more, for questions. If anybody would like to ask anything, please put any questions in the chat box that there is at the bottom. I mean, it's wonderful to hear what you are doing, because this is something that has been of concern for many years, and I've been around midwifery for over 35 years, and talking about the preconception role of midwives has been discussed and talked about for many in many ways, mostly because actually in the European directive it's an expected role of midwives to be involved in preconception care, and in the UK and Ireland obviously that is something that has been put to one side, unless you are involved in perhaps a diabetic clinic or something like that. So it's great to see that there is a move again towards trying to focus on the future well-being of the baby through preconception care. Do you think that there is anything that midwives can do to try and improve their involvement in the public health, in the I know you've talked about it from people who are already pregnant, but for those who are actually considering pregnancy, how midwives can get involved in that?
Yeah, I think it's a difficult one given the structure. And you mentioned there, Jenny, in terms of like midwives very much within UK and Ireland are very focused on when a mom is pregnant. But I guess the opportunity they have is maybe inter-pregnancy. That's one space. But we know that pregnant moms are most receptive. They're like sponges on their first pregnancy. You know, that they get distracted with other things after that. So I mean, I would love to see it being more part of the education in midwifery. Certainly, I trained some years ago, but it really wasn't part of it. And I think that we need to really start focusing, because we're missing such a huge nugget here if we don't. You know, it's impacting, you know, the time, the number of visits to a clinic. You know, it's impacting diabetes rates in pregnancy, complicated labours, cesarean section rates. It just goes on and on. So I just think we have to wake up around this space, whatever that looks like. But I'm certainly on a mission to sort of make some inroads with it, and to get people just thinking, and not to just see pregnancy as a journey to labour, to see it as a journey to nourish, and that whole fetal nutrition space. And, you know, just telling it more, because when I start to tell it, people sort of go, wow, I didn't realise that. And I particularly honed in on the journalists there, because I think they have a big job to do and work with us. And, you know, I had interviews with journalists when I did the Mum and Baby series last summer, and they were genuinely really, really interested in it. But it's just finding that space. And again, it all comes down to funding, and trying to get people on board. But as I said, I am working with pharmacy now, and I think they're definitely coming on board into the space. And maybe there's an opportunity there to bring midwives into that space. In pharmacy, because that's a lot of the time where the first interaction somebody ever might have with a health professional is in pharmacy, when they're thinking of planning a pregnancy, or they already are.
Yeah, but I mean, again, it's this. I mean, you've touched on it about saying that the people who tend to come for support about planning pregnancy, it's also how we help those people who fall pregnant without having planned anything, and how we can reach those people perhaps a bit better from a public health perspective, isn't it? Of actually, how do we improve the health of the population as a whole, which is a huge
it is a minefield, and I've been looking at it from several ways. And, you know, I asked random people, I did a bit of a random survey, and I asked people, but they really saw it as in you know, this word influencers, in social media, and that they have a big role to play. And in the modern day, maybe that's where we should be picking influencers across different population segments that we think may be the messengers. Because I know I'm not going to end up on TikTok, but maybe TikTok and preconception care work together. You know what I mean? So it's finding that TikTok person that can tell this story to the TikTok followers, you know, as life evolves. But I know that in David Barker's legacy, there's a lot of amazing work going on there, and they have life labs down there. So they're bringing in teenagers, you know, from marginalized and other communities to get them really thinking about reproductive health and developing healthy lives. So there's a lot of work, but we need to keep trucking.
Absolutely. Well, there are some questions that have come in.
Oh, wow. Okay.
So Lauren, hello, Lauren. Kathy, what do you recommend to promote gut health, particularly if the woman has digestive disorders such as IBS? And thank you for your great presentation. Just great presentation. So thank you.
Thank you. Sorry about a bit of a wobble at the beginning. Lauren, that's, I guess, if we just look mainstream at the mainstream population first, it's really gut health is about, you know, unrefined food. So let not our food be refined by the manufacturers of food, let us refine the food. And it's almost like we need to think of ourselves again as processors of food rather than eating processed food. So, you know, again, I referred to it briefly there. So fruit and vegetables, it's all that food that our grandparents would have eaten. So lots of fruit and vegetables, aiming for that sort of 5-6 portions a day, switching definitely from beige to brown. So a lot of those really refined carbohydrates are white. So if we can, even a simple message like, you know, beige to brown food will help. Stress is a big thing in terms of our gut health as well. In terms of IBS, I would tend that's more specialist, and to get some dietetic input, or there's some amazing support groups around IBS that would certainly, for something so specialized, that I would channel somebody down there. But again, you know, it's back to basics with our food. Try and eat food as it once started in life. If we look at a food and we can't pronounce the ingredients on it, I think leave it on the shelf. And go for food with the least amounts of ingredients in it. And if my test is if my grandmother would recognize it, I think that's a good thing. If I brought my grandmother back and she wouldn't recognize it, I try to leave it on the shelf.
That's a great message for all of us, isn't it? About how to think about our own diets and what we're actually eating. But Mary's Gilbert has raised a really good question, which is obviously something we as a society need to deal with. Thank you, Mary. Of how do you encourage a healthy, nourishing diet when a mum is on low wage or benefits and finds it just too expensive to eat well? Now, this is a big issue, isn't it? This is including the shops, actually, about how things that are vegan or actually fresh tend to be more expensive than those that are not. So
they do, but I think that things are getting better there. And, you know, if I was a farmer, I wouldn't like it, because I think, you know, I bought some carrots the other day, they were organic and they were 50 cents. Now, I don't know how that works, but certainly with some of the supermarkets, you know who I'm talking about, you know, they have their weekly deals, 6, you know, fruit and vegetable, whatever. So I do sometimes go in a shop and I think, okay, I have €5, what can I buy? And if you plan and think about it, it's, you know, it is achievable. I think it's trying to break down that barrier that it is more expensive, but maybe if we take people and educate and upskill in terms of what is possible, you know, doing maybe a virtual video with €5 or €10 or whatever the budget is, and virtually take somebody to the supermarket and actually show them what's possible. Now, it does take time and interest and commitment, but I still think it is possible to eat relatively well on a low budget. And it's not all about the fresh produce, you know, the canned produce, the peas, beans, lentils, you know, there are other things. So I think it's upskilling and really challenging that it can be more expensive, but it is still possible to eat healthily on a lower budget, but more difficult.
And that sort of raised its head, hasn't it, over this period of COVID with, well, certainly in the UK it has, around the issues of providing the packed lunches for children who are homeschooling. I mean, you've seen all the
I've seen a lot of it.
All the fuss around that. Yeah.
Yeah.
Go on, Karen, sorry. No, I'm interrupting you. No, it's for you.
It is, but again, I think it's that whole education piece. And I mean, like a sliced pan of bread, you know, isn't astronomically priced, you know. So sometimes I think we have to challenge back a little bit as well and say, well, look, you know, give an example. I managed to make this sandwich. The loaf of bread was X. I managed to put cheese in it, whatever else. You know, I think that we can't accept all the time that it is obviously more expensive and it's more challenging when you have a lower budget, but it's still possible.
Thank you. I'm really sorry, but I could carry on talking and discussing this with you, but I'm afraid we're going to have to stop because we have another session to follow on from you. But can people contact you via your website?
Absolutely, I'd be delighted. So they'll see more about me and what I'm aiming to do, what I'm trying to do on nurturemom.ie.
Okay, so it sounds like midwives need to get in there and try and see what we can do as a profession to help mums. But thank you, Kathy, for all you're doing. Yes. And look forward to hearing more later.
Yeah, thank you so much, Jenny.
It's a pleasure. Thanks. It's lovely to meet you.
You too. Bye-bye.